A sponsor spent 18 months and seven-figure budget generating flawless extractables and leachables data, clean chromatography, a tight uncertainty budget, a defensible AET. Then the FDA came back with an information request, not about the chemistry, about the story connecting that chemistry to patient risk. That gap between good data and a good submission is where most ENL programs actually fail. Hello, I'm Raghuveer Singh Parmar, Director Scientific Affairs at ResolveMass Laboratories, and we work with the pharma and biotech teams every day to turn ENL data into submissions that hold up under FDA and EMA review. Today, 10 of the most common reasons regulatory submissions fail on ENL grounds and exactly what to fix before you file. It's rarely the chemistry. Here is what the pattern shows across the ENL information requests. Reviewers rarely cite a chemistry failure. They cite a reasoning gap, a risk assessment claim, the analytical data doesn't actually support, or a leachable that appears with no explanation of where it came from. A submission can sit for months before that gap surfaces. Once it does, the clock doesn't pause. It resets, same data, different reviewer, same result if the underlying story doesn't hold together from the extraction to patient risk. What reviewers grade? So what is reviewer actually grading? Not just whether your numbers are correct, whether the submission reads as one unbroken chain of logic. Extraction conditions justify the analytical method. The method produces results. Those results feed a toxicological threshold. That threshold supports a risk conclusion. The moment a reviewer has to infer a connection instead of reading it, that's exactly where they'll stop and write a question. Most teams have the data, fewer have the written connective tissue between each piece. 3 places submissions break. In our experience, submission failures cluster into 3 categories. Scientific gaps, a worst case condition never justified, or leachable nobody explained. Documentation gap, solid data scattered across a dozen appendices with no CTD ready summary tying it together. And narrative gaps, technically complete data with no single thread connecting the chemistry to a conclusion a reviewer can sign off on. Here is the pattern we see most. Teams assume they have a scientific gap and spend months regenerating data when the real problem was the narrative all along. Let's be specific. Mistakes number 1 to 5. Mistake 1, leachables reported with no documented traceback to an extractables. Reviewers read that an incomplete study even when it is not. Mistake number 2, an AET stated as a number with no safety-based derivation behind it. Mistake 3, the same compound named differently in the analytical report, the toxicological assessment, and the drug master file. Small inconsistency, big reviewer confusion. Mistake 4, ENL data filed as a standalone appendix instead of woven into the CMC risk story. And mistake 5, PDE values cited without explaining how they were derived and why the route of administration matters. Mistake number 6, although 10 compounds, the problem sending the identical package to FDA, EMA, and NMPA without adjusting for how each agency expects PDE derivation and format, That's mistake 6. Mistake 7, no documented uncertainty budget. So a reviewer can't tell if your reporting limit is defensible. Mistake 8 is skipping a structured screen for a cohort of concern, mutagenic, highly potent or structurally alerting leachables. Mistake number 9, when the information request comes, resubmitting the same data instead of directly answering the question asked. And mistake 10, no forward-looking control strategy, so the submission reads as a snapshot instead of a commitment. We see this pattern across very different filings. A generic parenteral held up 8 months over a broken extractable leachable trace. A biologic in a pre-filled syringe drew an information request from phase 3 because the AET was never justified in writing. A device drug combination cleared EMA and then hit a deficiency at FDA because the dossier wasn't tailored regionally. At ResolveMass, we have walked sponsors through exactly this, rebuilding the narrative around the data that was already scientifically sound without regenerating a single extraction. Submission proofing the package. So how do you submission proof the package? Start by mapping every compound, so each leachable traces to a named acceptable or a documented exception. Justify the AET in writing, not just in the table. Align compound naming across every section that touches the data. Write the risk narrative as one connected argument, not independent appendices. Then run a mock review. Have someone outside the study read it cold and mark every place they had to assume something. That's exactly where a real reviewer will stop and ask. So what should you walk away with this today's session? So most ENL deficiencies are narrative gaps, not chemistry failures. Every leachable needs a traceable origin story. AET and PDE values need documented derivation, not just a citation. And the teams that mock review their submission before filing catch these gaps months before a regulator does. Next video series will walk through exactly how to respond to an FDA ENL deficiency letter, the structure that gets you to approval on the first resubmission instead of the third. If you are preparing an IND, ANDA or biologic submission, and you want a CRO partner who builds the narrative alongside the data instead of after a deficiency letter forces it, ResolveMass Laboratories supports pharma and biotech teams from the first risk assessment all the way through filing. Thank you so much for watching this video until now. See you in the next one, and until then, goodbye for now.